So yeah, the last talk of the morning introduces Faith Luke. Faith I've known for 20 years now, must be?
Yes, more than.
And more than, goodness gracious. All the comings and goings, Faith has been absolutely one of the most solid, reliable and dependable individuals I've had the pleasure of working alongside. So a constant source of support and inspiration with your clarity. So it's great to have you here today. We're going to talk a little bit about massage, bodywork, connection, neutrality and movement. And we've already had a couple of talks talking about the importance of relaxation and eliminating stress from our lives and the capacity that has to expand our consciousness and support healing. So I'll invite you and welcome you to speak to us all today. Thank you very much. Thank you.
Thank you. So I'm more used to actually speaking with my hands, to talking with my hands, than I am with my voice, so I don't know how this is going to go. But it's going to follow on from what Barbara said very synchronistically, because I decided to talk about connection, neutrality, which you've talked a lot about, and then movement into healing. So I think connection in this world at the moment is becoming more and more important, connection in community. And you know, there are more and more people learning to do hands-on techniques. In fact, there's a new therapy that's just come out that's been called neutral space therapy, which is very simple, hands-on technique that anybody can learn in a day. Connection is important because it's part of our support system. If we don't feel connected to everything else, if we don't have a social support system, of which very much touch can be part of that support system, then we're likely to be isolated, more depressed, and actually research has shown that they took a study, say, of over 1,000 people, elderly people who had diabetes. The ones who had a good support system were 50% more likely to live quite a lot longer. I guess my passion, if anything, is teaching people about touch techniques that help people connect with themselves, that help people connect with their inner knowledge, that help them feel cared for. I used to be a nurse. Half my life I was a nurse, and half my life I've been a bodywork practitioner. I don't really think it matters which technique you're using. You know, the goals are the same. So, also like to say that I'd like to have the opportunity to experience a little bit of hands-on, just for a change, because again, I was reading how somebody's done some research that it only actually takes 3¼ minutes of having somebody's hands on your body in a caring way, in a skillful caring way, to feel that something's changed, that's been a great help to you. So would you like to partner up for 3¼ minutes? So go and stand behind someone and just put your hands on their shoulder. You do exactly what you choose to do. Just put your hands anywhere on the shoulder. And I'm not going to direct you, because actually as long as you're gentle, the technique doesn't matter. Just go with your intuition while I'm talking. Is there anybody who can look at their watch for 3¼ minutes, please? Yeah. So if Steve could tell us when it's time to swap around. Yeah. So for each one of you, this quality of touch will be saying something else. You'll be allowing something else to arise, something individual to arise in your body. So safe techniques are important when we're working with chronic disease. You know, somebody who's tired, somebody who's fatigued, we're going to get into the dehydration cycle, you know, into pain, stress, anxiety, depression, fear, more pain, yeah, and that can just, again, be a catch-22 situation. So touch is a way of breaking that cycle, because if somebody feels there's a connection, there's an empathy there, there's a space for change, who knows what can happen. So sensitive touch, like the therapies where there's not a lot of pressure used, craniosacral, energy work, polarity work, very gentle Swedish massage, Bowen technique. These can all be used in the chronic stage of illness, because again, if you push somebody's system too quickly at the wrong time, it's actually going to have an adverse effect. So that there is the skill involved in knowing, you know, which type of therapy, which modality is going to be useful at a particular time in the stage of somebody's illness. I mean, I can't imagine what it's like to be ill for more than, you know, I think the longest I've ever been ill is a couple of weeks, really. So when you get into, you know, weeks and months, just having the support in your community, if not in a therapeutic setting, to have some body work, it's going to help. So that moves on to neutrality. So a neutral space is a place where you're not judging. You can come along, you can lie down, let your hair down, and you know, the person isn't there to talk to you, to ask you what you think, just to let your body unwind and say what your body wants to say. So as a bodywork therapist, I'm not trying to fix it. I'm not trying to fix the person. So we've had 3¼ minutes now. Just register how you're feeling after that 3¼ minutes and swap over. So, you know, going back to how little touch can make a huge difference. When I was nursing, part-time doing night duty while my son was young, I'd go around at night and people say, I can't sleep, you know, I've got this investigation, I've got some surgery tomorrow, I'm anxious, I can't sleep, but I don't want to take a pill, or I've got a headache, you know, I'm okay, I'm actually okay, I'm relaxed really, but I've got a headache. And it was surprising how little hands-on touch would actually alleviate that anxiety and help the person go to sleep without a painkiller and without a sedative. So that's just an example of how touch really works. Moving on to another study that's been done when we're looking at the immune system, and we're looking at diseases, chronic fatigue, rheumatoid arthritis, ME, cancer, all those sort of immune disorders. Again, studies have shown that as much as 58% improvement was gained with people who were having regular massage. This is people who had conditions like HIV, like breast cancer. Hundreds of them were having regular massage, hundreds of them weren't, and the ones who were having regular massage had a 58% improvement in their general health, their pain levels, and also the levels of certain things in their blood to help with their immune system. Their NK cells were measured. Now, NK cells are natural killer cells, and their lymphocyte levels were measured, and they both went up. And there's part of the immune system that can help destroy cancer cells. It's also a part of the immune system that can help monitor and destroy virus cells. Also, the cortisol levels went down. The stress hormone level went down. So you can see how that's going to aid recovery, it's going to aid health. Working with chronic health, that again we have to be safe. Again, we have to be really watching what is going to arise and when the right time is to use whichever techniques. And often people think, well, for cancer, don't use massage. We mustn't move things around. We mustn't irritate. We mustn't cause the lymphatic system to spread the cancer. Well, again, doctors will tell you that you don't spread cancer. You don't make cancer happen by massage. You don't spread it through the lymphatic system. What spreads it is the propensity for the tumour cells to metastasize. Well, you do have to be careful is that if somebody's got lymphedema, you need to work very gently. You don't need to stimulate any more inflammation. If somebody's got a tumour site, okay, 3¼ minutes, relax. Yeah. Somebody's got a tumour, you know where the tumour site is, you will stay away from that completely. And there's certain keynotes to oncology massage that you would need to train in to be safe in that way. And to be safe, always, if in doubt, always liaise with the person's doctor. Coming into movement now, from that place of allowing a space for pain levels to drop, for anxiety levels to drop, because I think that's one of the biggest things that bodywork can offer, a space, a neutral space for the body's emotions to come and to flow away again, to ebb and flow. Because to me the water element actually is also about the unconscious emotions, the well of water in our belly that bubbles up when we cry, when we feel an emotion. It comes from here, and from the flesh of our body. So the minute you're tuning into flesh, you're tuning into the water element. So once that can start to move, once the river starts to move, you can start to grow new abilities to invigorate the body. So after cleansing, if somebody is cleansing to do with food and drink, then if you actually bring in bodywork techniques also, it's going to accelerate the ability to cleanse. Again, bringing in more invigorating techniques, acupressure, more deep tissue massage, those sorts of things. Everybody is individual, and as Barbara was saying, you need to listen to the person's story. It isn't just a matter of doing X, Y, Z. You listen to the person's story and respond to that in a caring way. Okay, so more touch, more permission for touch, more teaching other people how to touch. Thank you.